I'm Dr. Chirantika Vitana, Consultant Community Physician, National Program Manager, Adolescent and Youth Health, Family Health Bureau, Ministry of Health. Today we are starting the session 4 on the workshop of Adolescent and Youth Health. We will be talking about physical activity and exercise. Objectives of today's session are to discuss the importance of physical activity and exercise in adolescents and to differentiate between physical activity, exercise and physical fitness. What are the differences between physical activity, exercise and physical fitness? And to discuss the physical, psychological benefits of physical activity and exercise. There are several benefits of physical activity and exercise. What are they? And what are the types of physical activity and exercise? And to describe what are our national recommendations on physical activity and exercise? What are the myths? What are the correct facts? So we will discuss all these. As you all know, basic concept are need of physical activity, type of exercise, types of physical activity and the national recommendations and the benefits of physical activity and exercises. So what are these terms? Physical activity, what do we mean by physical activity? What is exercise? What is physical fitness? Now we are going to see. Physical activity is any bodily movement produced by skeletal muscles that result in energy expenditure above resting level, that means basal level. More than basal level, energy expenditure is there. We do body movements. So that is called physical activity. When it comes to exercise, it's a type of physical activity that is planned, structured and repetitive. This is something planned, structured and repetitive. It is important for the improvement and maintenance of physical fitness. So it is very much important for physical fitness, physical activity as well as exercise. So now we will see what is meant by physical fitness. That is ability to carry out our daily tasks with vigor and alertness, without undue fatigue, with ample energy to enjoy lesser pursuits and to meet unforeseen physical challenges and emergencies. So we would be able to do our daily tasks with alertness and vigor without much fatigue, and we will come over the physical challenges and emergencies and we will face them very well. So then we are having physical fitness. So when it comes to physical fitness, physical activity, physical exercise and everything gives you physical fitness. So what are the benefits of physical fitness? So it includes cardiorespiratory function. So you will be fit with cardiorespiratory function. That is ability of your heart, blood vessels and lung to supply oxygen-rich blood to work in muscles and tissues. So your muscles will work well, they will get enough oxygen through blood, heart and everything. And there will be ability of muscles to use oxygen to produce energy for movement. So in addition to that, your muscles will be able to utilize this oxygen and there will be movements. And next part of the physical fitness is body composition. What is body composition? That is that our body is made out of fat mass, bone, water and muscles. So water composition is 60%, protein 15%, fat 18% and minerals they are in bones mainly are 7%. So we have to maintain our body composition. Physical fitness include that as well. And body mass index is one of the measures where we analyze body composition. So we will talk about BMI later. Other components are muscle related fitness and measurable skill related attributes. So they are the components of physical fitness. Muscle related component is muscle power, strength, endurance, flexibility. All these are included in physical fitness. Measurable skill related attributes are we are able to maintain balance and ability to move quickly and easily, that is agility, and reaction time, the time taken to react for a stimulus, that is also within normal range, so we are physically fit. Now other components we will discuss about muscle power and muscle strength. What is muscle power? That is ability to generate as much as force as possible, as quickly as it's quick and as much as possible. So that is muscle power. What is muscle strength? Muscular strength, ability of muscle or group of muscle to exert force to overcome most of the resistance in one effort. One effort we can overcome the resistance, that is with resistance. So your muscles are strength. And muscles should have endurance for you to be physically fit. What is endurance? That is ability of muscle or muscle group to exert force to overcome resistance many times, not one time, many times. Muscle flexibility is the range of motion of joints or ability of joints to move freely. Your joints are able to move freely. That is because of muscle flexibility. Now we will discuss about physical and psychosocial benefits of physical activity and exercise. So, what's the importance of physical activity and exercise in adolescence, especially within adolescent period? Uh, we will do it as group work. One group will discuss physical benefits while other group will discuss psychological benefits. So, what are the physical benefits? It will strengthen your muscles, physical benefits of physical activity and exercise, and strengthen your bones, and your cardiovascular system will be healthy, neuromuscular awareness is there, neuromuscular system will be healthy, maintenance of a good body weight will be achieved. So these are main physical benefits. Other physical benefits are reduce the risk of diseases like stroke and improves immunity, then you will not get much diseases, reduce your high blood pressure, and it helps you to keep your blood pressure within normal range, and enhance the quality of sleep, you will get a good sleep, and reduce risk of cancer. It is proven in evidence that exercise will reduce breast cancer and colonic cancer in the community. Psychological benefits are also very much important. Psychological benefits of physical activity and exercises are production of a chemical called endorphin. You might have heard about the endorphin. Exercise or physical activity increase the production of endorphin. This endorphin is responsible for a person to be happy, and the person will feel good if person is having endorphin. And for better self-esteem, when you are physically fit, you will have a better self-esteem, and you have self-confidence, and you have better ability to cope with anxiety. Today's world is full of anxiety and the stress, better management of stress, and control of symptoms of depression. If you have any symptoms of depression or mental unwell feeling, you will control these feelings. Better social interaction and integration when you are engaging in physical activity with others. And now we will move on to recommended level of physical activity. There are WHO cutoffs, national identified levels. So we will discuss about it. When it comes to the adolescents, adequacy of physical activities like this. If somebody is having an average of 60 minutes per day of moderate to vigorous intensity physical activity across the week, that means in all 7 days, if you are having 60 minutes physical activity for day, you are having sufficient physical activity. That means you are sufficiently physically active. That 60 minutes may be with 10 minutes 6 sessions or 30 minutes 2 sessions. That can differ. Minimum time is 10 minutes per one session. When are you insufficiently active? That is identified as, for adolescent, physical activity less than 60 minutes per day of moderate or vigorous activity across the week. That means any day, if you are not getting 60 minutes physical activity within a week, you are not sufficiently active, you are insufficiently active. Sedentary activity is the habitual lack of physical activity and being seated most of the time. You are not physically active, you are seated most of the time. This is based on the Sri Lankan recommendation, that is for adolescent. When it comes to the WHO recommendation, this recommendation is for 5 to 17-year group. At Sri Lanka, this is the recommendation for adolescents 10 to 19 group. When it comes to the young adults, that means over 20 to 24, their guidelines and adequacy is similar to adults. So they are called sufficiently active if at least 150 minutes of physical activity during a week. That is the level they should get to be physical active. That means half an hour per day for 5 days or like that, or we can do it differently, we will talk. Insufficient physical activities, if somebody is getting less than 150 minutes of physical activity in a previous week, that is called insufficient physical activity. Sedentary activity is if somebody is called sedentary if habitual lack of physical activity or being seated most of the time. If you are seated most of the time, it is taken as sedentary. Now we will move on to the what is insufficient physical activity. Insufficient physical activity is one of the leading risk factors worldwide. Sedentary life is non-risk factor. This is a key risk factor for non-communicable diseases. If you don't have sufficient physical activity, there's risk of getting non-communicable diseases early. It also leads to overweight and obesity. Overweight and obesity are resulted from lack of physical activity as well as unhealthy diet. So this is one reason. And globally, 1 in 4 adults are not active. They don't get sufficient physical activity. Over 80% of adolescent population is insufficiently physically active. So this is a problem. What are the types of the physical activity? We should know what are the types. We are always doing physical activity. Some may not do, but we should know what are the types of physical activity. Concept related to physical activity, under these you should know duration, how long in minutes, how often, frequency, in sessions or bouts per week, and the intensity, how hard a person should do physical activity. So now we will come to the measurement of intensity of physical activity. Intensity is usually always expressed actually using metabolic equivalents, METs. What is MET? MET is the ratio of person's working metabolic rate relative to the resting metabolic rate. That means working metabolic rate is divided by resting metabolic rates. So you get METs. 1 MET, what is 1 MET? 1 MET is defined as energy cost of sitting quietly. You are not doing anything, you are sitting quietly, is equivalent to the calorie consumption of 1 kilocalorie per kilogram per hour. So that is energy cost when you are sitting quietly. So we calculate METs like this: person's working metabolic rate divided by resting metabolic rate. A moderately active person should have 3 to 6 minutes, while vigorously active person will have more than 6 minutes. So, we will compare moderate intensity activity with vigorous activity. That is important. We should know what are the intensities and what activities are there. Moderate intensity activity is energy activity that causes an increase in breathing. Your heart rate and breathing will increase, but you can maintain a conversation. But you cannot sing. You cannot sing. Your heart rate and breathing increase. You can maintain a conversation. So you are doing moderate intensity activity. When you are doing vigorous activity, that is aerobic activity, it causes you sweating, puffing, cannot conduct conversation, and it increase heart rate and breathing. It increase and heart rate breathing. You cannot conduct conversation with vigorous activity, while moderate intensity activity you can continue conversation while heart rate and breathing are increased. So we should know what are the types. Moderate intensity activity, that means energy expenditure 3 to 6 minutes. When you are doing brisk walking, dancing, gardening, housework, domestic chores, traditional hunting, gathering, active involvement in games and sports with children, walking with domestic animals like walking with dogs, general building tasks like roofing, touching, painting, carrying a load or weight less than 20 kilograms. These activities are identified as moderate intensity physical activity. What are the vigorous intensity physical activity? If you are running, walking over or climbing briskly up the hill, fast cycling, aerobic, fast swimming, competitive sports and games like traditional games, football, volleyball, hockey, basketball, and heavy digging of ditches, carrying and moving heavy loads, that means loads over 20 kilograms. When we are discussing the types of physical activity, there's a categorization aerobic activity. First type is aerobic activity. Second type is muscle strengthening activity. Others are strengthening activity, bone strengthening activity, anaerobic exercise. So we will discuss about these types: aerobic activities, strengthening activities, muscle strengthening, bone strengthening, uh, anaerobic exercises. So aerobic or endurance activities is the other name for aerobic activities, uh, in which young people rhythmically move their large muscles. We move our large muscles rhythmically, right? Running, skipping, when you are cycling or track, increase heart rate. This will increase heart rate, promote increased use of oxygen in order to improve body condition. So you will use oxygen more and you will improve your overall body condition. And examples are running, jogging, hopping, skipping, jumping rope, swimming, dancing, household chores, climbing stairs at work, cycling, sports like tennis, basketball, soccer. All these are aerobic exercise that keeps your heart and lung and circulatory system healthy, and it will generally increase your overall fitness. When it comes to the muscle strengthening activities, what do you understand by muscle strengthening activities? These activities make muscle to do more work than usual during activities of daily life. They may be structured or unstructured. First, we will see what is unstructured muscle strengthening activities. These are happening when we are playing with playground equipment, climbing trees, digging or gardening, push-ups, pull-ups, sit-ups, playing tug of war, abdominal crunches. So these are muscle strengthening activities while they are aerobic activities. Structured activities are lifting weight or working with resistant bands. Resistant bands, working with resistant bands is very important for muscle strengthening. Muscle strengthening activities give benefits. This is called overload. It improves strength, power, and endurance of muscle. So, strengthening your muscles, strength, power, endurance. And stretching activities, you can see what sort of things are stretching. You are stretching. Stretching helps to improve your flexibility and ability to fully move your joints. So, you are moving your joints. Touching toes, side stretches, doing some sort of yoga. Yeah. And benefits are improves flexibility and ability to fully move your joints. So, if you are doing a stretching exercise, you are able to move your joints fully. So, these are the example: yoga workouts, stretching exercises, fitness workouts. So, you are stretching. And bone stretching one, all these activities are happening in one exercise, but you have to identify what are the bone stretching activities that produce pose on bone. This pose is commonly produced by impact on ground. We have impact of ground with feet, legs, arms supporting your body weight. These are supporting your body weights. Then muscles push your bones. So, bones are strengthening. Running, jumping rope, and walking, basketball, tennis, hopscotch, all these are the examples. So, a lot of things you are getting from one exercise. It may be you will get aerobic activity, you are getting muscle strengthening, bone strengthening, but you have to ensure that you get all these from your physical activity and exercise. What is bone strengthening activity? We'll discuss further. These activities can be also aerobic and muscle strengthening. Benefits are promote growth and strength of the bone. So, it promotes growth and strength of the bone. Aerobic activities we have discussed. Now, we come to anaerobic exercise. These are slow rhythmic movements against the forced, such as some sort of push-ups, sit-ups, weightlifting, that means heavy weightlifting. This evoke minimal increase in heart rate, and this is happening in anaerobic environment. That is strengthen the muscles, joints, increase joint mobility, and reduce musculoskeletal injuries, but their lactic acid is forming. Oxygen is not utilized. That is why it is called anaerobic. Then what is the fuel used? That is the glycogen. Glycogen is used as the fuel. Your body build up lactic acid then. So, you can't do this anaerobic exercise for a long time because it causes discomfort and fatigue if you are doing in sustained level. So, these exercises happen in short bursts. So, we will see the difference between a sprinter, that means anaerobic exercise person, and a marathoner, aerobic exercise person. Sprinting is all out effort, so you do once. That is sustained for comparatively shorter period. So, anaerobic things you can't do for long period. Whereas marathoning is a sustained effort over long period. Marathoning is aerobic, so you do it for a longer period. What are the categories of physical activity? In context of family, school, community, these activities are play, games, sports, transportation, household chores, recreation, physical education, planned exercise. All these are categories of physical activity. In these, some are recreational activities. You are doing it not as a competition, but without formal set of rules. And sports, these are competitive activities with formal sets of rules and require specific skills. And in an organized manner you are doing. Active transport, you are not going in car or vehicle, you are walking for some distance, this sort of thing, or cycling, that is active transport. Now we will come to the Sri Lankan recommendations of physical activity. This is based on Sri Lankan guideline. So we have actually discussed some component of it. What is physical activity, what is inadequate physical activity, what is sedentary. Now we will see in detail what is physical activity recommended for adolescents in Sri Lanka. Average at least 60 minutes of moderate to vigorous intensity activity is needed, including as muscle strengthening activities, bone strengthening activities at least for 3 days per week. Further, flexibility maintaining activities for 5 days per week. You have to do activities strengthening flexibility. So it's for 60 minutes, include muscle and bone strengthening activities at least 3 days and flexibility maintaining activities for 5 days per week. When it comes to the more detail, daily physical activity should include aerobics, vigorous intensity activity should be incorporated, including those strength muscles and bones. At least vigorous activity should be at least 3 times a week, and also muscle strengthening and bone strengthening activities 3 times a week. How can we do this physical activity of 60 minutes? Some may think that you don't have time, but you can do in bouts, shorter bouts. At least one bout should be 10 minutes. So, if you are doing 6 10-minute sessions, you are getting 1 hour 60 minutes. That means, or 30-minute 2 bouts will come up to 60 minutes. So, you are getting 60-minute exercise. When it comes to the youth of 20 to 24, recommendation is same as adult. You should at least get 150 minutes moderate to vigorous physical activity. That means aerobic activity per week. At least 30 minutes of physical activity for 5 days. So each session can be 10 minutes. So if you are doing 3 10-minute sessions per day, that is okay. But you have to do for 5 days. It will ultimately should come to 150 minutes per week. Alternatively, if you are doing vigorous intensity activities, you can do 70 minutes spread out throughout the week. That is vigorous activity. In addition, if you are doing more physical activity up to 300 minutes per week, that is having more advantages regarding to your health. There should be muscle and bone strengthening activities for adults or those who are above 20 years, at least 2 or more days. Exercising with resistance is also important for muscle and bone strengthening. Should also incorporate flexibility improving physical activity daily for greater benefits. See, these recommendations are same as adults. So, 20 to 24 group recommendation is same as for adult. Physical activity, hydrating and food. We will see how much water, food that we want while we are doing physical activity. We should drink food and take food before, during and after exercise. That is very important. You should be well hydrated. Before exercise, drink enough fluid, and after exercise you have to drink fluid to compensate for fluid losses. And now we'll discuss about the myth related to physical. There are several myths in the community among adolescents as well as parents regarding physical activity. First myth we are going to discuss is exercise make you feel tired. Is it so? Correct fact is during regular exercise activity, you sleep well in night, endorphin is secreted, so you feel very fit and you are more refreshed and energetic. So, exercise doesn't make you feel tired. Next myth in community is being physically active is expensive. So you have to have a gym equipment, you have to go to a gym, you have to have sports shoes, clothes. So it is also incorrect. You can do exercise anywhere when you are going to school, going to work, going to some shopping or something. That doesn't need any special equipment. If you want, you can have, but that doesn't mean exact need. Other myth is it consumes time. We don't have time for exercise. So we have discussed very well, it requires only 1 hour per adolescent. And it can be done in several bouts. You don't have to expend 1 hour at a stretch. You can do 10-minute sessions. This can be done within routine activities as well. Adolescents are anyway active. That is also wrong. Evidence says that adolescents are not getting enough exercise or physical activity. That means 60 minutes of vigorous activity. There's evidence they are lacking. So they should do physical activity. Need not have any restrictions on diet if they are engaged in physical activity. That is one myth. You have to have physical activity as well as you have to have a healthy diet. Then only you will get healthy BMI. So only physical activity will not do. You have to have a healthy diet. And further, before exercise, drink enough fluid, and during after exercise, you have to balance the fluid losses. I'll answer some of the frequently asked questions. Lack of time for exercise or physical activity. So adolescent will tell that we don't have time, we have a lot of work. So I'll show how we are having enough time. If unable to engage 30 minutes or 60 minutes at a stretch, do 3 sessions for 10 minutes for those who are between 20 to 24. If you are below 19 years, 6 sessions of 10 minutes throughout the day. So that is possible. If you cannot find time within weekdays, you can do this physical activity. Weekend, you can do some physical activity while watching TV. And you have to plan your physical activity schedule for the week and indicate this plan in the calendar. That is how you make it reality. Maintain a diary about it. Physical activity is so important. Second thing is how to increase physical activity done in a day. Within the day, if you are doing a desk job, in tea breaks, you can have 5 to 10 minutes walk. You can park car somewhere far away from your office or working place or training institute and make a habit to walk to the destination. Walk in flights of stairs at least 10 times a day. Then you will be having physical activity. These are the way to increase physical. Another way is step count. Aim for week is to increase step count by thousands. So ultimately you will reach 10,000 steps per day. You have to increase gradually. It may be considered as a method of developing mindfulness. While you are working, you can do mindfulness, though there will be additional benefits as well. But there are safety tips. We have to follow safety tips when we are doing exercise. If you are having any chronic disease, you have to consult a doctor. Otherwise, there's no need to consult a doctor to start physical activity or exercise. If you choose to wear shoes, you have to wear comfortable, well-fitted shoes. If you decided to wear shoes, otherwise no need. Wear comfortable clothes, that means cotton cloth. Start slowly and build up gradually to stop and rest if you feel tired or breathless. If you are breathless or tired, you have to stop. Other tips are don't exercise when you are not well. If you are having fever, headache or whatever it is, don't exercise. Avoid injury by overstretching. Don't do overstretching of muscles. Stretching exercise should only be done after warming up. Any proper exercise will be started after warming up. At the end of the exercise, you have to do cooling down. Warming up before the exercise, cooling down after the exercise should be at least for 5 minutes. Avoid hottest times of the day. So, we have discussed about what are the physical activities, what are the exercise, what are the benefit, how we can utilize our time to make us healthy by being physically active according to the national recommendation. If you want to read more, this is the reference. So, we will be physical active for a better world. Thank you.